I'm Beverly Kirk here with Janet Fleischman. She's a senior associate with the CSIS Global Health Policy Center, which has just released a new report on global health policy in the second Obama term. And we're talking about women's health, one of the 7 policy areas that was covered in this report. Thanks for being here.
Thank you.
So first and foremost, why has the issue of women and girls and gender equality become so important to U.S. foreign policy?
Advancing the issues of women's global health and gender equality has really become one of the most pressing issues of the 21st century. And U.S. policymakers have come to realize that investments in these areas, and I'm referring to voluntary family planning and maternal health, gender-based violence, HIV services for women and girls, these investments have huge returns, not just in terms of the global health outcomes, but also in terms of poverty reduction and broader development and economic prosperity. So in the words of former Secretary of State Hillary Clinton, investing in women and girls is not only the right thing to do, it's the smart thing to do.
What are some of the opportunities to move forward as we get deeper into the second Obama term and with the new Congress that just took office?
This is really a pivotal moment for women's global health issues in the U.S. There's been significant bipartisan support for these issues, exhibited by the gender strategies that were developed under the Bush administration for the PEPFAR program, but then very much elevated under the Obama administration in terms of policy development and strategies to address the issues of women's global health and gender equality. We can be building on the investments that the U.S. has made in these areas and advance U.S. strategic interests in protecting women's and girls' rights and advancing the health of communities and families. So it's really in the U.S. strategic interest to be looking at these issues as a cornerstone of U.S. global health policy.
You've talked about the advances that have been made. Are there challenges? And if so, what are the challenges that you see lying ahead?
There are many challenges in the road to greater advances in women's global health and gender equality. One of them is the current issue of the departure of Secretary of State Hillary Clinton, who has been known to be a champion of these issues. And so it will be important to see in the coming months how much the issues that she has championed become embedded in the second term, or whether some of that focus will disappear with her departure. So that's a big challenge that we'll have to confront. There are also some politically polarizing issues, particularly around the question of abortion. There are some politicians who erroneously equate abortion with family planning, even though using abortion as a method of family planning is prohibited by U.S. law. There is still that debate sometimes, and so those issues will have to be navigated, particularly in the Congress. And it will be important to show at a time of budget constraints that these investments in women's health issues really matter and are priority issues.
What issues are emerging at the country level that impact the policies and the programs?
The U.S. is not doing this alone. So it's very important that you have the partnership of national governments, civil society groups in those countries, as well as other development partners and multilateral organizations. So it'll be important to see where you have those partners and how you can be working in countries that are prioritizing these issues for themselves in their own countries. At the same time, there are laws and policies at the country level that are sometimes very much opposed to advancing women's global health and gender equality issues. So these are the kinds of issues that will have to be examined at the country level and that present challenges in implementing the kinds of policies that we've been discussing.
The report offers a number of recommendations. Can you talk about perhaps what the priority should be as we move forward?
One of the most important things is high-level leadership in the U.S. to show that the policies that have been developed are actually embedded and that the U.S. government agencies are directed by the president to implement these policies and these strategies so that we can begin to see outcomes in women's health and that they will be held accountable for success in these areas. It's also an opportunity for the president himself to initiate a high-level discussion about some of the issues like voluntary family planning, and to include a broad range of stakeholders in those discussions to show the importance of these issues for women's health going forward. The second area I would say is implementing for results and really translating the policies and the strategies that have been developed into programming on the ground. And this requires developing metrics so that the policies are designed and implemented appropriately, and that they are measured, that the outcomes are being measured, and that country teams that are actually moving forward with this kind of programming are recognized to motivate progress in other country teams, to show that this really does matter, and to begin to track the outcomes so that we can guide program development in other countries. Another important area involves partnerships for sustainability. How can we be working with national governments, multilateral organizations, and civil society groups to be able to really begin to develop priorities and programming in a way that leverages U.S. investments? So again, it's not just the U.S. doing this, but working in partnership with a wide range of partners that will ensure a more sustainable response to women's global health going forward.
All right, Janet Fleischman, thank you so much.
Thank you.